Hey everybody, Danna here with Lean Healthy Ageless and the co-author of the Eat Live Thrive Diet, and excited today, women, to talk to you about your man's health. Now, whether you're married or maybe you're gonna think about your father, your brother, but the men in your life need your help. So today I've asked Dr. Mark Stengler, my naturopath, a prolific author and an incredible physician, to talk about his new book, Healing the Prostate. Welcome, Mark. I'm so glad to have you on Lean Healthy Ageless.
Well, thank you, Danna.
Well, let's talk about why the prostate is such a concern, especially as men age over 50. The stats are kind of interesting.
Yeah, it really is. I mean, there's about three main prostate conditions men deal with. And of course, as they age, they become more prevalent. But first is prostate enlargement, known as BPH, or benign or non-cancerous prostatic hyperplasia. Fancy way of saying the prostate's enlarging. We have to remember the prostate is a gland that's involved in reproduction. So it produces prostatic fluid involved in fertility, but it's located beneath the bladder. And basically, for a lot of men, as they age, the prostate enlarges, and then the bladder has a urinary tube that drains it, urethra, and the prostate encroaches on it, kind of pinches off that tube, so to speak, and then men have the problem of frequent urination during the day, frequent urination during the night. They have to get up multiple times a night. We call it nocturia. They can have a feeble stream. They may be prone to bladder infections. And so prostate enlargement is very, very common in men. If you're 50 years of age, you've got about 50% likelihood you have it to some degree. And if you're 90% likelihood. So very, very common. But the good thing to know is basically through the things you teach and I teach, proper diet, maintaining good body weight, using the right nutritional supplements, you can do a lot to prevent it and actually treat it too. So there's a lot of help out there for men. But a lot of men, they just kind of, put up with the symptoms for a period of time. And then when it gets so bad, they either need pharmaceutical medications, which can have side effects, or they need surgery. So we don't want them to get to that point.
So a man can avoid surgery if he does some of the more natural approaches, preventative things. So this actually is good for any man, whether he's in his 30s or 40s. The challenge is that most men don't see it as a problem till they start noticing the frequency and all that.
Right.
So
yeah.
When that prostate is enlarged, is that increasing their risk of cancer specifically?
No. The prostate enlargement is separate from prostate cancer. Obviously, it's just very, very common. And so basically, with all the prostate conditions, for the most part, as men age, it's a very unique kind of thing to think about. As men age, their testosterone levels go down. People always think, oh, well, testosterone is the problem for the prostate, but really that's not the case. So as men age, their testosterone goes down, and then their metabolite of testosterone, known as DHT or dihydrotestosterone, tends to go up, as well as estrogen levels go up. And really, in literature, it's very well known now that it's the estrogen and the DHT or dihydrotestosterone which causes the prostate gland to enlarge. And that includes both prostate enlargement and also plays a role in prostate cancer. I mean, that's kind of one of the main hormonal connections there to the prostate. Now, there's other factors. If you're eating a diet that's, high in inflammatory foods, processed foods, high sugar foods, the wrong types of fats, that contributes to prostate enlargement and inflammation as well as prostate cancer risk. So things like this. So the prostate enlargement, there's a hormonal connection, but behind that connection, that hormonal connection, it tends to be weight. So for example, in men, fat cells contain an enzyme which converts testosterone into estrogen. So the more fat you have, the more estrogen. And if you have nutritional deficiencies like zinc, for example, you get higher levels of that hormone, dihydrotestosterone. So that's how we tackle this problem. We work with the diet, the weight, we use supplements which block the hormonal stimulation of the prostate gland, and that's how men get better.
So what are the key supplements and lifestyle changes? You've mentioned weight. You've mentioned a more anti-inflammatory diet, so healthier fats, less processed food, all of that. What are some of the supplements or other lifestyle changes that you would recommend for men?
Yeah, well, with men, in the long run, one of the big things is avoiding xenoestrogens because they mimic estrogen in the body. So whether it be, moisturizing creams you're using, if you're still drinking out of plastic bottles, if you're not eating organic food, all these things over time, they mimic estrogen in the body. So that's one thing in the long run. But in terms of nutrients, there are studies showing for both prostate enlargement and prostate cancer. If you're vitamin D deficient, you're more likely to have a problem with both conditions. So that's an easy thing to test and treat. Zinc, your prostate gland, out of all the organs in the body, has the highest concentration of zinc. And the zinc is very important because, again, it prevents actually the buildup of estrogen and the dihydrotestosterone. So it's very, very important. So making sure you have adequate zinc levels through the diet or supplements. But in terms of prostate-specific supplements, many studies done on saw palmetto, people have heard about it, saw palmetto. And interestingly, there is some research showing that saw palmetto at the right dose and concentration can mildly reduce the size of the prostate. A lot of doctors out there think you can't reduce the size of the prostate with natural treatments, but it's been demonstrated in studies before and after ultrasound you can. There's another one you'll see promoted a lot on TV called beta-sitosterol. It's been shown in many studies to help with the symptoms of prostate enlargement. We use supplements like pygeum. That's been shown to help the urinary symptoms associated with prostate. And what I think maybe you've talked about in the past, pycnogenol, or pine bark extract, that's actually been studied in men, shown to help the symptoms of prostate enlargement and the frequent urination. So very interesting. And probably the unique thing in the book, Danna, that I do, you don't see in the other books, I take a little bit different approach. We do those things and they will help men, but you get much better results actually if we help men with their bladder function. You know, as men age, the tone of the bladder also tends to become more problematic too. It becomes weaker, the muscle inside of it is more spasmodic. And so when we treat the bladder, typically herbally, and there's certain herbal supplements you can use for that, we get much better results with your urinary symptoms, which is usually the main problem, rather than just treating the prostate alone.
Interesting. Okay, I have a question, Mark. I've known several men who in 50 plus, more like maybe 70 plus, have bladder cancer. Is there a correlation with bladder cancer, prostate? In fact, one of them had prostate cancer many years before that and then ended up with bladder cancer. My father is one of them that had not prostate, but bladder cancer. Is there a correlation at all? And you're talking about bladder health and all that.
No, not in the literature. I mean, they all seem to be separate issues. I mean, one thing I've seen with bladder cancer definitely seems to be a correlation in some studies with men exposed to certain toxins in the past. So you're right. Prostate cancer is the number 2 cause of cancer death in men behind lung cancer. It's the most second type of cancer in men behind skin cancer. So it is common. Now, fortunately, 90% of prostate cancers are slow growing. So a lot of men die of some other disease and don't even know they had prostate cancer. But if you're in that 5 to 10% where it's aggressive, you know, it gets outside that capsule of the prostate, spreads to the bones, the vital organs, and it's very serious. And here's the problem. I mean, prostate cancer is really one of those silent diseases. I mean, men don't know that they have it. I mean, most men over age 50, 55, they have some urinary issues. Maybe they get once a night, maybe 3 times a night, a little bit more frequency during the day. The stream's not strong. So they don't know what's related to. They think it's just normal aging and just regular prostate enlargement. So a lot of men who don't get screened by their doctors, their first symptom of prostate cancer, unfortunately, is something like bone pain. Okay. You know, I've got this bone pain and it's not going away. And then you get a diagnostic image and all of a sudden you find you got metastatic cancer to your pelvis or something like that. So that's the problem with it.
I see. Well, should any man who is experiencing significant frequency, urgency, some of these symptoms you've been talking about, should they be checked once a year as a man over 50? What should we women be encouraging our men to do? What's reasonable?
Yeah, well, I think what's reasonable, if there's a strong family history of prostate cancer, your father or grandfather or your uncles, whatever, brothers who've had it, you should really be screened once a year. You know, you should get examined by your doctor. You should get some blood work done, including a PSA test. It's kind of a general screening test. If you're a healthy person, there's not much of a family history, you know, you can still get tested once a year or every other year, especially if your PSA tends to be pretty normal. If you look at the associations that give guidelines on this, basically on like a PSA blood test. It's by far not a perfect test, but it's a general screening test. It usually goes up about, a normal lab goes up from about 0 to 4 units, let's say. And so they have found that if your level tends to be below 2.5 or less than 3, you know, it's a small likelihood you have prostate cancer. So then maybe you could be tested like every couple of years if you're maintaining a good level. If you're a man who's just overweight, you've had urination problems, yeah, you should find out why that is. You may even have something like a low-grade urinary tract infection that's causing the problems.
Right. So why should every man over 50 read your book or his wife buy it for him?
Well, I mean, statistically, I mean, virtually every man's going to have a problem. I mean, either prostate enlargement. And look, it's not fun if your, husband's getting up 3 to 5 times a night, go to the restroom, and then things get more severe, and then they need to be on medications. Some of the medications used for enlarged prostate and help the urination, and they can cause anything from dizziness to fatigue to sexual dysfunction, digestive upset, all these types of things. So we don't want to get to that point. So men who have mild to moderate prostate problems in urination, they do very well with the kind of natural treatments we talk about in healing the prostate. If there's any family history of prostate cancer, maybe your husband's diet hasn't been great over the years, then we want to take the steps now to prevent prostate cancer.
Yes, absolutely. And do you address in the book the different types of surgical treatments? Because I know there's some choices men have to make if they do have to pursue surgery. Do you give a little bit of information on that?
Yeah, we do get into some details, including even some newer genetic testing. So let's say you've been diagnosed with prostate cancer. Let's say you've had an MRI and it's showing prostate cancer, still localized. Now there's some new genetic urine testing you can do, which tells you, with pretty good accuracy whether it's likely to be aggressive prostate cancer or not. And that helps to decide if you really should get a biopsy or not. A lot of men are wary of getting that done. So that is newer technology, which is helpful. There is different surgical treatments. There's different medical treatments if you have prostate cancer. And even if a man has prostate cancer, whether it's slow growing or more aggressive, we do talk about the integrative cancer therapies you should incorporate so your immune system works better and you can tolerate the conventional treatments better too.
So this prepares them whether they're just starting to have mild symptoms, facing off potential cancer. Your book will equip them to be knowledgeable. I know from having gone through breast cancer, I mean, it's a learning curve. It's better to have some of that education on the front end if you can, knowing, I mean, probably more men have a risk of enlarged prostate than women do of breast cancer because.
Oh, definitely. Yeah. Yeah. About 1 in 8 women in America get breast cancer. And in terms of men with, prostate enlargement, like I said, you're about 50% likely to 90%. So much, much more common. And then, of course, we do talk a lot about how to balance hormones for men. How can you improve the testosterone, even naturally without medications, yet keep the estrogen and dihydrotestosterone down so you don't, get prostate problems.
I want to encourage all of our viewers to get a copy of Mark's new book, Healing the Prostate. I've provided a link with the show notes. And so get that in your man's hands. If you have to, maybe you skim it and highlight it and give him the cliff notes if you need to. But we can make a real difference in the men in our lives' health by being educated ourselves. So thank you, Mark, for letting the girls talk about a men's issue today.
Yeah, thank you.